I am Doug Stockman, a family physician practicing in the Rochester, New York area. More than 20 years ago, I desired for electronic health records to do more to help me care for my patients. About 8 or 10 years ago, I decided to make some programs to help me care for my patients. I realized my no-show rate in my safety net practice was approximately 22%. So I created a very simple program at that time to text appointment reminders to my patient the morning of their appointment. I got the no-show rate down to 14%. Presently, about 40% of my patients do not speak English because I have a large refugee population. The current EHR we use did not allow me to communicate with patients in other languages such as Arabic or Dari or simplified Chinese, so I started writing my own programs. I want to share with you a few examples of some of the software I have been working on over the past years. Hopefully you'll find some of this information helpful. I do say that many of my unique solutions are intellectual property. So if you want to include them in your programs, please let me know. Let me share my screen and we will get started. What has happened over time is I created individual programs to meet many of my needs, but now I have been combining it all into a basic electronic health record. Prior to me seeing patients, I send appointment reminders as I had said. My current appointment reminder program has definitely grown well beyond what I initially wrote. This is my group text program. The way it is set up for the most part is to send text messages to multiple recipients at one time. On the left-hand side are some of the common text message as I send, such as this one right now is my appointment reminder message. And what happens is it takes the patient's first name in this instance, and it includes today's date. And then it will take my first message, which is 1:20 p.m., and that builds a message that I send to the patient. I can choose various other messages, such as I created a Zumba class for Muslim women, and many of them speak Arabic, so the program can also send messages in Arabic or in other languages that are supported, and there are about 20 different languages supported. So it's pretty straightforward. Once I have this information in, all I have to do is just click this button and this message will go out to the patients on the list. Let us just see a message preview for the first patient to make sure it is working. And this is an example of the message that will be sent to Edward in using simplified Chinese for most of it. So I will send those messages out, and both Edward and Edwina have now been contacted. Oh, it looks like Edward had sent me a message previously. So I can actually use this program to see what he had sent back to me. Great, I can delete that. Now I can also do one-off messages with Edward, such as just type a specific message right in here. And that's a free text. Now I have multiple tabs here so that I can have more than one list of recipients going. As an example, let us say I have patients who routinely need to get their INR done. So I could have one of these recipient lists be the common list of my patients on warfarin, and it makes it very easy to remind them to go get their warfarin at a certain time. I can also import a comma-separated variable file with information that is not in my electronic health record. Another thing this program can do is I can stagger start times and I can send them at various increments. As an example, if I put in today my patients for tomorrow, I could say start texting at 7 a.m. and text every 15 minutes so that they get the message 1 hour or an hour and a half before their appointment time, as an example. I can even have a conversation with selected patients so that we can go back and forth in real time if we wanted to. What I have found is many of my patients, particularly the ones that do not speak English well, cannot access our patient portal in the university electronic health record. There are many other aspects to this program, but it gives you a general idea. Another program I wrote many years ago allows patients to check in at a kiosk. Now, this program supports multiple languages, so the patient can choose which language they want to use to enter their information. Given I don't speak these languages, we'll just give an example with English for now. So I'm going to choose Edward Test, and he's going to check in. If the patient had chosen a different language, all this text would be in their language. Now, there's a huge amount of ability to customize this program. Right now, I have, after the initial check-in screen, a reason for visit screen pop up, but the end user could have it just end at the reason for visit screen. Could have it end at the patient check-in, and that just sends a message to my software and arrives the patient with a specific time. For this example, let's just put in some things that Edward might want to talk about. And this is just an example. This was set up right here as a kind of review of systems or problems he would like to talk about or a patient would like to talk about. So let's just choose some of these. He needs med refills today. He used to smoke and he's safe at home. What I have set up next is the patient can choose other questionnaires they would like to complete. As an example, Edward has diabetes and he says it's not going so well. So let's just choose some things that he might have going on. Then Edward, if he's high functioning, could even enter some of his vital signs. As an example, you could have a scale and a height and a blood pressure machine and even an oxygen saturation machine out in the waiting room. So higher functioning patients can enter their own vital signs. Now, Edward is also quite depressed, so he's decided to fill out his PHQ-9. And let's say he's not doing very well at all. Fortunately, he's not going to kill himself today. And then when Edward has finished filling out what he'd like to fill out, he can just finish this, and information says wait to be called. Now going back to our electronic health record. We will go into Edward's chart and show you a few things. One of the first things that I started doing of late is I have multiple common conditions in primary care that are being tracked by the program. And this is analyzing Edward's chart and telling me what he has of some of the common things I see. It also tells me, oh, A1C has been too high. No additional chart deficiencies have been found. It even gives me all the details for the tracked problem, such as tells me the labs, color codes if something is out of range, such as his A1C is up to date today, but his micrel is out of date, even though the value is normal. And then we include vital signs, some of the healthcare maintenance stuff like foot and eye exam, which are needed. At this point, I've included blood pressure pills as well as the diabetes meds. Same thing for hypertension, lipids, thyroid disease. For congestive heart failure, I just started playing with the program telling you if the patient has gained or lost weight compared to the most recent value as well as the average value. And you can dig in further for more information for a lot of this stuff, but this just helps you right away. Let's switch for a second to Edwina to show you another aspect of the program. So the chart was analyzed by the program and it found that diabetes was not on the problem list, but the patient has A1Cs that suggest she's a diabetic. Same with hypertension, same with obesity. So you can see this, and then you could start adding these to the problem list if you so choose. Same concept for Edwina. Let's go back to Edward. One of the first things we can do is we can view if Edward had check-in answers. And here it is. He said diabetes not going well. The program is smart enough that it picked it out and it included the diabetes pre-visit questionnaire he completed, and it highlights some of the positive symptoms in bold. Then it includes social automatically, and for review of systems, it included the positive answers in red. He said he needs meds refills. He didn't list depression as a problem today, so it went to the depression PHQ-9 screen went to a screening questionnaire. It marked in red the fact that his PHQ-9 is way too high. Then it also included his patient-entered vital signs. So the program has essentially taken what the patient entered and already started a SOAP note for you. Some other things I've come to realize is when I'm seeing a patient, I often have to look back to find out how long were they on metformin, what dose were they on before, that sort of thing. This program allows me to explore some of these issues. By selecting the medicine, and I can display all the meds, and then I can even generate a report. And what it does is dulaglutide was the most, was prescribed only once, but look at metformin. It is been prescribed at 1,508 milligrams, and it tells me when I started, how long he was on it, although I didn't really have the dates for this test patient in here, but he's been on metformin 1,000 milligrams for 1 year and 278 days. So this helps me figure out very quickly where the patient has been in terms of all the medicines. Another thing I found with my patients is they cannot read their med list very well. So what I've done is I created a program to create med lists using their language. I can also use graphical representations for those who cannot read. Many of my patients who don't speak English may also not be able to read. So I can create medication lists. In this case, I chose to include the patient's language and graphic representations. So I don't speak simplified Chinese or Mandarin, but this one says amlodipine, take 1 pill nightly by mouth for hypertension. And based on what interpreters I work with tell me is that this is pretty accurate and is close enough to simplify Chinese for the patient to understand how to take a medicine. The graphics are kind of placeholders right now. This says take by mouth. This one says with arrows going around a clock, take around the clock. If the question mark is taken, that's take as needed. This is nighttime, so it says take amlodipine at bedtime, and this suggests that it's for hypertension. Now, when you have pictures of the actual med the patient is taking, you can include it in the medication list. I have also set it up so that a small camera can be used by staff to take pictures if it is not in your database of the actual pill the patient has. This is an example where the patient has anxiety, as you can tell, taking by mouth around the clock, and they're supposed to take one pill twice daily. So patients have found this very helpful when they don't speak English. All these graphics, such as diagnoses, etc., are kind of placeholders. They can be updated very quickly by the end user without reprogramming anything. You get to choose what the images are for each of the diagnoses. Some of the other things I have been working on is, let's say the patient, I'm looking at his labs, and here are his A1C values over time. I can graph all the A1Cs, and more importantly, what I can do is overlay all the medicines on the graph of the A1C to see when I started a medicine on a timeline and its effect on the A1C. I can do the same thing for things such as LDL or thyroid level, that sort of thing. A similar concept exists for vital signs. Edward hasn't come in a while based on my vital signs. I haven't pulled in yet what he entered today. But let's say I look at the last 50 values for Edward, and I can do a summary to tell me how many values this is, first value, last value, min and max, the mean, and it tells me if the blood pressure is going up or going down, both for systolic and diastolic. So in other words, it does a lot of the thinking for me and gives me information that makes more sense to me when seeing the patient. I can do the same thing for blood pressures. In terms of overlaying medication dosing and starts on the graph of blood pressures. It helps me figure out where things are going. It also tells me usually if a patient is probably not taking a medicine. Using the university's EHR I use, I sometimes have to really dig in to figure that out. One example is a patient was on a statin and they were well controlled for a couple years, and then their LDL went over 160 and they kept saying they were taking their medicine, but it was pretty clear when I manually went through everything that they were not taking it. These are some of the health maintenance issues that the program is tracking, and I have many more that can be added by the end user so they can track different things. The program also makes it very easy to order what's missing. So a vaccine was just ordered, ophthalmology, podiatry referrals were placed, and labs were ordered. Another thing I've been working on is analyzing the patient chart. You already saw kind of the summary of that. And this is what you saw before. It also includes the healthcare maintenance. I can also do detailed analysis, such as I'm looking at Edward for type 2 diabetes. I can do the same graphing like I showed before, but this also looks at the medicines and tells me if I can increase or reduce medicines based on what's going on. Also tells me if it's been used before and how often it was used. For meds that are in the database, it includes things like what strengths are available, maximum recommended dose, and how to start out the medicine and when to be cautious in terms of things to watch out for when prescribing the medicine. Same concept for vital signs here. I can graph it and overlay medications. Same thing here with vital signs. Another thing you can do is you can load in a table that shows you over time for, let's say this is an example of diabetes and how their A1C has been doing over time. It highlights me with colors as to things that are out of range that I set up. So it helps me know what to do very quickly. As one example, let us say we wanted to build a note different from what the patient entered or the patient did not enter anything. This is a very easy way to build a note from the Analyze patient chart. Let's just do an example here. And we're building a note as we go. It's happening over here. So let's display the note. And it pulled in all the information on each problem. So it makes writing a note very, very quick and easy, and it helps the clinician clue in on what may be needed for today. I forgot to show you another part, which is, let us say, I want to send the patient a letter about the results. This is a very simple letter generator to help speed up sending the patient results. As an example, let's just go through this. It was a pleasure seeing you recently. Thank you for getting your lab test done. Your diabetes test is improving from last time. Cholesterol level is almost normal. Based on these results, nothing needs to change at this time. I look forward to seeing your next appointment. We will discuss possible changes at your next appointment. So I can quickly generate a letter to the patient. What makes this more interesting, though, is I can generate the letter in another language. So Edward speaks Mandarin, and this is simplified Chinese. I have included the English translation, and it includes the values of the labs that were selected. So this makes it very easy for me to communicate in the patient's language. And by the way, all these things are end user selectable. You can even add a few other things like please make sure you are taking your medicines, and then that will go in with the note as well. Other things I found helpful is when I'm seeing a patient in the room, I often make referrals, but they don't know where the office is or how to call the office. So with this program, I can just select the specialist I want to send them to. And then if they have a cell number in the system, I can send them a message via cell texting. I've also included the Google Maps. So as an example, Edward speaks Mandarin Chinese on his phone. Google Maps is set up to run in Mandarin. So when he clicks on this link for the office location, it will guide him in using Mandarin. Taking this concept a little bit further, I have written a program that can give appointment reminders to patients. And let's say Edward's going to see this chiropractor at 8 a.m. I want to include the patient language and English. I can move this stuff over, and this says in Mandarin or in simplified Chinese and in English that he has an appointment with Charlie Bodley, and I can either print out the letter or I can send it as a text. I've also created to-do lists. for Edward. So this is where I can track things on Edward that I want to handle. This one is for Edward specifically, but in another part of the program, you get to see all the to-do lists that have been entered into the system. Given I have active patients in there, I cannot show you that right now, but it helps you manage the to-do list so that you don't forget what needs to get done. And you can even have staff or an interpreter work the to-do list based on date or patients or problems or acuity level, etc. Now I have been working on some note types. Let's just see what we can do here. Now I could create a note from the patient answer. Oops, got to choose in there. And this just pulls in everything that was in what the patient entered, and then I can start creating a note. Let's get rid of that for a second, and let's do a 3-visit note. And I have various ways to build this note. I can insert into the note section both subjective and assessment plan, diabetes, if I wanted to include data and details, I could also do that. And that includes more of that information that we might need. This right here allows you to see what consultants are involved with each problem. As example, Dr. Colin is the specialist working with the patient on his constipation. So you can see that right in the note. Also includes all the usual things like graphing vital signs, tests, etc., like you've seen before, and overlaying medications as you have seen before. When I add in problems to my note, it automatically puts it into my diagnoses. Putting in a level is very simple, and follow-up is also very simple. I also have a section built in for patient instructions, which makes it very easy in that you can have patient instructions in multiple languages. A more complicated note I have been working on, but is a long way from being done, is this. It's kind of using the concept of an airplane cockpit. We'll be working on the note right here, but I have all the information I need over here and prior visits over here. So if I had prior visits that included some of the problems, I could build my note from the prior visit. And include all that information that was in from the prior visit. I have the usual things for social history, such as check boxes, etc. And it builds it very quickly if I want to do it that way, or I can just type it in. Same thing with physical exam, assessment plan. What I have found is I often create what to think about for next visit, and this program makes it very easy. I can save a problem to the next visit. So that I can start dealing with that at the next visit, and I can write in what I want to deal with at the next visit. So this note is just beginning, but it gives you an idea of how you can pull from problem list, or how you can pull from past notes, or even from the things you said next visit. You could also move that over as you build a note. This is a high-risk patient tracker. It allows me to add a patient who I feel really needs additional help. It includes some of the things such as some of their special needs. Let's say for Edwina, I think I have in here Her specialists are in here. I can include social determinants of health that are a problem for her, and I get to enter new details, or other things I have to work on, and I can also finish off from here from a high-risk patient tracker. Other thing I created a long time ago was Medicare put in a chronic care management module whereby if you spend 20 minutes or more outside of an office visit on a patient, you can get paid an additional $45 or so. This program makes the tracking of time you spend on a patient much easier. Let's say I'm calling Edward about disease management. I can start in just saying calling Edward. And what happens is the program is tracking how much time I'm spending when I am with Edward or trying to call him. I can document in this window what is discussed and what we decided. I can pause it as someone interrupts me, and then I can restart. When I finish, I can view the report and how much time was spent and what we talked about. This allows you to see lots of other stuff that has been sent to Edward and what was spent on time-wise for him. Now, Medicare required care plans to be generated for these patients. So I have a care plan module. This makes it very easy by just selecting various things to build a care plan. I can also build it in other languages and include English. Let's just look at some prior care plans so you get an idea of what I'm talking about. So this one was for Edward when he was speaking Spanish instead of Chinese. And this just tells you how a care plan was built for this patient. You can even include patient data, such as their results, and you can mark it off as red, yellow, or green to help Edward understand what's going on and what to focus in on. You can even compare care plans over time. So you can compare what has been happening with Edward on his care plans. Now, at the end of every month, we would basically generate a report that would tell us who we can bill for. Because I haven't done much with Edward lately, let's just include the last few years so we can see the data. Generate the report. This lists all the contacts for all the patients that have occurred in this time frame. Then what I can do is I can choose to say, if a patient meets 20 minutes to 60 minutes, please tell me who met that so I can bill. It includes the billing diagnoses to use and the time frame for the report. Usually this would include 1 month of information. You can send this to your billing person then by saving it to an Excel file, and they can bill out. Another program that I have built is a population management program. This example includes the patients who are on my list today, but I could build a search criteria to pull from my database. Let's say all the patients who are mine, and they have a diagnosis of diabetes. So this would pull in all my diabetic patients. I could even go further and say, give me all my diabetic patients who have an A1C over 9. I cannot show you this right now because it would pull in actual patients. For the patients that are on this list, I can perform basic statistics such as demographics, age, gender, that sort of thing. Diagnoses for this list of patients, what meds they are on, that sort of thing. This also includes the to-do list because I'm managing a population. I could look at the patient's to-do list and decide what I want to handle as I'm managing the population. Patient reports, I realized a long time ago that my mechanic was giving me better reports about my car than my doctor's office, so I created some simple reports. This one is for diabetes, and it creates a report that color codes what Edward is doing in terms of his diabetes. This one includes specific information put into text if Edward is a person who likes details and wants to know more about it. I've also included a patient report card for preventive stuff. This one uses less text and more explanation, but then includes the same thing with Edward values and color coding to help him focus on what he may need to do. Another thing is for my list of patients today, I could run a report to tell me what I need to do for my patients today as I see them in the office. I can do a very simple report like this that helps me focus on what's needed for today's visits for my patient population. I can also color code it, which might help me do a better job focusing on what's really needed today faster. So for Edward, his A1C is too high. It's getting close to time to order the test. He's definitely behind on getting his micrel done, and his thyroid test was behind. And that's for Edwina down there. The population management program makes it very easy to contact my patients either by text or email or letter. I choose the text I want to include here. And if I just type in here, because he's a diabetic, it would replace the message. It would put Edward's name in here, and then in the message, it would put in diabetes. And then I just have to say send to cell, and it would automatically contact the selected patients. I've also built into the population management program a nice simple way to track, as I showed you before, time spent managing Edward. There are so many more aspects to this program that I could show you, but I think we will stop here. I think you have a good idea for what is going on. Hopefully you found this helpful.